you know, I want to talk about hyperpigmentation.
Yeah.
Um, Sun is a great segue. Hyperpigmentation comes in many forms. I'd love to talk about the full spectrum. I can tell you that our audience, our community is usually coming to us because they are someone said, is Hyper going to create a product? So much pressure.
So much pressure. I get that too. Everyone wants me to make a sunscreen. So I understand. Maybe we can collaborate and figure this out.
Because right now I'm still a chemical sunscreen girl. So, well, let's see. But yeah, I do want to talk about hyperpigmentation. Our community is typically coming to us with acne scarring. That's the most common of hyperpigmentation that we are, you know, hearing about and tackling on a daily basis. Melasma comes up. There are other forms, but I'd love to talk with you about your experience in office because it's very different. I'm seeing customers coming in, you know, looking for products and a skincare regimen, and I know you are on the other side of the
spectrum. Yeah.
And you know, it's just a different ball game. But I think our customers, you know, are very holistic and they want to hear about all sides of treatments and efficacy. Love thoughts on hyperpigmentation and your experience.
So I think it's important for people to understand that brown spots, hyperpigmentation, can be caused of one of two things. It can be an outside job or it can be an inside job, right? So in general, hyperpigmentation is just unwanted unevenness of your skin, right? And so it's some areas being darker and some areas being lighter than you would necessarily want. And those changes oftentimes make us look older or less desirable to ourselves, right? So this is why we fight it. So in general, hyperpigmentation develops either because direct damage from the sun. So particularly if you get a lot of sun, you might have cute freckles, but those cute freckles then may turn into age spots or sunspots. So that's one form of hyperpigmentation. There's hyperpigmentation from hormones. And so women who get a lot of sun and also are on birth control pill are going to have more issues with pigmentation. And that is estrogen primarily. And so if you're on the birth control pill for a long time, you can have hyperpigmentation. And then there's also just a genetic predisposition. And there's individuals who are fair who make a lot of brown, and there's individuals who are dark who make a lot of brown. But that brown usually develops after some sort of inflammatory or trauma. So you irritate your skin, you pick at your skin, you get a procedure that irritates your skin, and then that inflammation leads to the formation of brown. They all work in synergy together. So if you're on the birth control pill and you're out in the sun and your skin's irritated and you're genetically predisposed to make brown, you're really in trouble, right? Like that's the hardest one, right? So really the goal is ounce of prevention. So ideally you wear your sunscreen every day so you don't get the brown. If you're making a lot of brown, you try to get off the birth control pill because that's going to contribute to your brown. And if you're somebody who's prone to making brown, you really have to have the conversation with your dermatologist before they do procedures on you. And I can laser people of all skin types, but if you are a darker skin type and let's say you do have brown from your acne, I'm going to make you do prep work ahead of time to make your skin be less likely to make brown. I'm going to make you do prep work afterwards to maintain the results, because you really, everyone's skin has its good sides and its bad sides. And so you want your practitioner to know what's great about your skin and what's problematic about your skin so we can really meet you where you need to be met. But, you know, new injury to skin, if your skin is fair, might look pink. If your skin is darker, it might even start being brown. But at that point, that's when you really have to baby it. You have to protect it. You need to not use ingredients that are going to irritate your skin to minimize that inflammation so you don't get as much brown. And that's where acne is like every single day. I'm like, don't pick. You're only going to make it worse. You're going to make that brown spot worse, and it's going to be harder for us to fix this because any additional trauma is really going to contribute to the brown.
Yeah, yeah. And I love that you mentioned like addressing it very early as well. We are often speaking with customers and, you know, people in our community, and they are, you know, speaking about the difference between dealing with hyperpigmentation that just occurred, which is obviously easier to treat, versus, you know, something very stubborn that they've had on their face. I'm sorry, New York is like so loud.
Yeah.
Pattern that they've been dealing with for months. And yeah, you know, the sooner the better. But I'd love to know, are there any do you have any go-to treatments, especially that are, you know, ideal for all skin tones that
So totally. So two things. If it's new hyperpigmentation or new irritation, you know, exfoliation is going to be a problem, right? So when somebody's skin is actively being inflamed, that's really where you just baby it. And this is where a restore comes into play, right? You take away your actives, you use zinc-based sunscreen because chemical sunscreen can be irritating. You wash your face with a gentle cleanser. You use a really good, clean, non-irritating face cream, and that's really all you do. Once your skin is no longer actively inflamed and it's just the shadow that's left, that's when HyperSkin is like your best friend, right? It's got vitamin C, it's got salicylic acid, but it's not too aggressive. And I think people need to understand that if little is a good thing, doesn't mean a lot is a better thing. And often with people who have darker skin, if they go after it too hard, they're going to inflame their skin and we're going to move backwards. So, I mean, I'm so, we aren't talking about HyperSkin yet, but I'm just so pleased with your product on so many different levels. And one of the ways I'm pleased about it is that you don't say use this twice a day. And if you look at every single product out there, it's like wash your face twice a day and then follow it with our 14 step of other products, right? And you're like, hey, put this on in the morning or the night and it's going to help. And it does, because you're not going to get irritated by it because it's well formulated and it does what it's supposed to do. Now, if you're actively inflamed and irritated, yeah, stop for 2 weeks, but then get back on that train because you need that vitamin C, you need those antioxidants, you need that salicylic acid to just constantly, slowly pull away the brown. And this is a marathon. It's just, you got to stay on it.
So I love that you say that. I am probably, or not now, I'm pretty reasonable now, but I was probably your worst patient. And so I know the mentality of when your skin is not doing what you think it should be doing. If it's having really aggressive breakouts or stubborn hyperpigmentation, you try to do everything. And I get customers, I'll get, you know, inquiries, and they'll ask, I'm using, you know, this prescription, I have this niacinamide or whatever the, you know, ingredient of the day, this serum and that serum, where do I use your vitamin C? And I'm like, you don't, like, you're doing too much.
Totally.
That's the mentality. It's like, you just, when something is bothering you, you want to stop the problem immediately. I don't think that we're all as reasonable as you in terms of just knowing, like, keep it simple, nourish the skin. But yeah, I think I've learned that because I've been in a place where I've done too much. And so when you know, with formulating and speaking to this serum and future things, less is more. I really do try to lead with less is more. And so impactful ingredients, but we don't need like everything at once.
And I think that we are told by the beauty industry that more is better because that's how money is made. And really over the last 2 years, I think you and I talked about this a little bit before, everything has become individual ingredients. So you need your niacinamide and you need your hyaluronic acid and you don't. Like, I don't even like hyaluronic acid. That's a separate conversation. But it's become so compartmentalized because those are singular products that then you have to buy. And so we have, you know, humans have been around for a really long time. Our skin is really good at taking care of itself. And oftentimes what it needs is a little bit of rest and time away from whatever you're doing to it. And so once you learn that, you'll really actually get to know your skin better and what it needs because you're listening to it. And so when things are going well, you got to have, you know, you need your HyperSkin every day. But as soon as your skin gets irritated, yeah, you stop that step, get the skin barrier back on track, and then great. But you can't ask your skin to do more when it's not doing the basics well, right? And I think people have to understand that.